I think it's a whole slew of emotions, honestly, Taylor. I mean, it's a case of, is this really true? And then you want to try to make sure you get, the most realistic picture of what's happening. Is it just some of the outpatient services? Is it just some of the inpatient services? And, and then, when we discovered it truly was everything but behavioral health, I mean, that's a big ticket now.
Mm-hmm.
And so then, once you figure that out and you say, okay, we're comfortable, this is it, then we had to start looking at the progressive dates. So the initial notice, as on July 19th was by the end of the year. And so then that promptly moved up to August 31st, and then that moved up to, even earlier than that, as we know by, the emergency room closing last week.
Mm-hmm.
And so, that's been probably the biggest challenge, and understandably from their standpoint, they were trying to staff and trying to do what they could. But from a community needs standpoint, it pushed things onto us really quickly. One of the first questions everybody asks me out in the public is, when did we know about Davis's planned closure? And we found out on July 19th, the same day that the public found out, the same day the employees of Davis found out. And so, it's been an extremely hectic 4 to 6 weeks, and it's going to continue to be a whirlwind for a while. First things we had to do is figure out, what all was going to come our way, and then try to be prepared for it. Oh, rapid fire. I would tell you that, the team of, managers that we have here at the organization are, have been around, in other organizations and have seen challenges like this in other parts of the country. So, we knew end of the year probably wasn't it.
Yeah.
Just because once you announce something like that, understandably, individuals start to look for new jobs. And as you don't, have folks to staff, then what else do you do but look at new dates? I mean, you're not going to find new employees to come to work when they know that the place is closing in a month or two.
Yeah.
So, we knew end of the year was a date that wasn't going to remain there. But really for us, every time it moved up, it just put, kind of, further fuel on the fire, to make sure we were going as quickly as we could. And some things you can't go fast enough for, for a 4-week notice. It will put a good deal of stress on our system, because as much as having 2 hospitals in town, it created a bit of a challenge because neither hospital was always full enough for some specialties. And so it was, hey, I'm spending money that maybe I don't need to be spending, but if they have it, we have to have it kind of mentality does exist. So, from that perspective, that goes away. But the other thing that, having 2 hospitals in town always provided was a backstop. So, if someone drove into our emergency room parking lot and it was full, they might not even come in. They might just turn, just knock it out of the car, drive back out of the parking lot, go over to Davis, or vice versa.
Yeah.
And so not having that, is something that there's no doubt we're going to feel. We will feel it from our surgeons when they say, hey, we want to put on another OR case, and, your slots are full, where do we put it? And so it's, the emergency room is probably the most obvious example just because it's a unexpected urgent need. But we're going to feel it throughout, multiple departments. Almost every department in the organization will feel it, either already or will start to feel it progressively over the course of, individuals' healthcare needs. Sure. So first thing we did was, we said we need to have a really quick way to help individuals get jobs if they so want to remain as a healthcare provider here in Statesville. There's a ton of jobs out in the community. We recognize that, but at the same time, we know that if somebody's been working in a hospital, working in healthcare, that's what they want to do still, and so we did multiple job fairs. We actually did 3 job fairs, and we had almost 100 individuals attend those job fairs, the majority of those being, active or recently departed Davis employees, although there were some other folks from the community, which was fine also. We have hired probably at this point more than half of those individuals from those job fairs. I know that, our most recent employee orientation was over 50 people, which is more than twice our normal. That was 2 weeks ago, and we actually added one this week, which was an off week for us. We usually have orientation twice a month, and we added a second one or a third one this month and brought in another 25 people. So we have hired well over 100 people, in the past month. And our goal is to continue. When we looked at our past openings prior to Davis closing, we probably had about 80 positions to be filled in the organization. Our analysis showed we probably needed another 120 to 150 employees because of the growth from Davis. And so that puts us at a 200 to 250 person need. So while 100 sounds fantastic, we still have a lot of openings and then a lot of need. And so that's going to be a progressive resolution for us. It's been really refreshing. I would tell you that the majority of folks are thankful to have choice. Are thankful to have an opportunity to still work in the town most of them live in, and we're happy to do that. We're proud to be able to do that. I think that for some there probably will be a little bit of a get over the competitiveness curve. Because for years it was Iredell versus Davis of a feeling, and that doesn't exist anymore. And B, it honestly it never really needed to, because individuals can choose in the community where they want to have their care, and we want choice is not a bad thing. Yeah. At this point, from a hospital standpoint, there isn't going to be that choice, and we respect that, and we're going to make sure that we're the choice for the community either way. Yeah, I mean you can work progressively on it. So as an emergency room, we probably handled about 60%, maybe 65% of the business here in Statesville. But if you think about that, that's 35% that we didn't handle. That's a lot of business. So we are seeing approximately between a 20 and 30% increase each day to our volume just from a month and a half ago. So we're feeling that. What we've done immediately is, we've changed our staffing patterns. We've added staff. We have hired more travel staff, which are very expensive nurses, but you have to have them. So we've hired those individuals. They started just this week, actually. So, we're looking to say, how can we make sure from a manpower standpoint first, because honestly, that's the first thing we can do. Secondly, we're going to have to look at, the building, and then is there anything else we can do in the short term for getting more exam rooms and getting more opportunities for patients to be seen promptly. And we're looking at that. We've had our architects in. We have some sample drawings of a couple options of what we can do, but we are actively looking at, in the short term, what can we do to change the design in the emergency room. And that could be flow, that could be how you're triaged, that could be how many rooms we have. There's a whole bunch of options on the table. Then finally, from a long range standpoint, we have to look at what's the right size for the future. This was an issue that, of course, didn't exist 2 months ago.
Yeah.
So 2 months ago, our board of directors approved a $14.5 million project to increase the size of our critical care unit, which is right on top of the emergency room. And so at that point, our plan was to use basically the same shape as the emergency room, add a second floor that could be an expansion to critical care. We haven't, done final drawings. We haven't signed documents that say this is the price. So what we're looking at is, do we expand that? Do we push the entire building out farther, which will give us more critical care unit beds, because we're going to need those also, because there were 6 of those at Davis, which are now gone. And then we will also have the opportunity to look from an emergency room size standpoint. What else do we need to do there? We are going to have challenging days, and I apologize for it from one standpoint, because I don't want anybody to have to wait for care. At the same time, I would ask for patience while we continue to work through a dramatically new norm that was handed to us. And we're happy to do it. We're here for the community. That is always going to be our goal. But it will take us some time, and it will be different every day. I think September is going to be a really interesting month for us, Taylor, because this will be the first month that we'll actually see what is it like to be a solo hospital in Statesville. So where the second the announcement came, we started to see some ER volume bump. You still don't know what that means until there isn't choice. And there's still always choice. Someone can choose to drive to Lake Norman, somebody can choose to drive to Huntersville or to Clemens, but recognizably, from a Statesville area, now that is gone. And so the month of September is going to be really eye-opening for us, just to see what happens each and every day. I think as we see that, our immediate and biggest focus is going to be the emergency room. Is going to be making sure that we can handle the flow, and as we've described before, that we have multiple plans to do that, but it's going to be to make sure that it's happening, because that is the front door to the hospital for so many people in this community, and you need it, and you don't know when you're going to need it, and so we recognize that. Secondly is making sure we work from an OB standpoint, because there's a lot of babies born in Iredell County, and a portion are born here, but a portion were born at Davis, and there's a childbirth center at Natural Beginnings that's kind of halfway between Davis and Iredell that has a lot of births up in this part of the county, and then obviously Lake Norman does. And so we're going to need to see how that transitions, and that gets even quirkier, because you have moms that are halfway through their pregnancy, and how does that change their plans, and we don't know that yet. That's one that only time will tell. I actually met with both a pediatrician and a OBGYN this morning just to kind of hear how did week 1 go. And it's every day's different. Every day's a new day. I think I would just close on the fact that Iredell Health system has been in the community since 1954. We're proud of our nonprofit status. We're proud of our local community status. We have always said that our mission was to be here for this community and improve the health and the wellness of the folks in our community. And while this is a new hurdle, we're proud to be the ones to be here to work on it, fix it, and make sure that we have great health care for our community moving forward.